Hey guys, and welcome back to another episode of the Modern Moms Club podcast. Today I have a very exciting topic and guest with me. I have Vanessa Dougan. She's a pelvic floor physio and postnatal fitness expert. Okay, so what does that mean? We're going to dive all into is peeing yourself normal after pregnancy? All of those questions that, maybe aren't talked about too much, but that we need to hear about. So Vanessa is a pelvic floor physiotherapist with a passion for helping moms take power over their minds and bodies while achieving an active life after babies. She's on a mission to ensure no woman believes peeing their pants is normal and will never believe just deal with it is the answer. She helps moms get a stronger core, learn to love their post-baby body, and learn to balance all the things that come with being a mom. So Vanessa, thank you so much for being here today.
Thank you so much for having me on. I know, I love seeing you on Instagram and stuff. So I know you talk to a lot of moms. I love how you kind of present these things to moms. So I think it's an awesome discussion we're going to have today because I know a lot of moms could use this help.
Yeah. When I initially did a little teaser for the topic, I had so many moms reach out. I'm peeing my pants. This is me. I need this information. I need this content. So you're not alone, ladies. And we're going to get into all the myths and facts. So you're going to debunk some myths for us and give us the facts. So if all the ladies, now we have moms that are pregnant, and then we have moms that may have multiple 3, 4, 5 and on kids. So for the moms that may not be sure about what this is, can you explain to us what is the pelvic floor and core?
Sure. So we'll start with the basics. It's kind of like going back to school because I'm going to teach you a little bit about anatomy, but we're going to try to make it as fun as possible because I want this to be something that you actually listen to and you don't zone out.
Yep.
So the pelvic floor, the way that you can describe it is the pelvic floor is like the hammock that sits at the bottom of your pelvis that keeps everything in. It's an inlet, it's an outlet. It not only holds and supports your organs inside the pelvis, but it also has to be flexible enough to allow yourself to open up, whether that is to go pee, whether it is to have a bowel movement, whether it is to birth a child, or whether it is to go through the intimacy of being with a partner and having sex. So it has to be this flexible structure that doesn't really exist in any other part of the body that needs to be strong enough to support everything and do its function, but at the same time be nice and flexible that it can also allow for the other functions that are essential to life. When people usually talk about okay, well, what exactly is that? I understand it's kind of like a hammock, but what is it? It's essentially a group of muscles and ligaments that make up the pelvic floor. They surround all our openings, so the urethra, so where we pee from, the vaginal opening, and the anus. It needs to have all those openings as well as kind of closing them up when those muscles squeeze together. You could imagine if we had a bone on the bottom, a bone wouldn't allow the flexibility of actually opening up for the things it needs to do.
Right.
But it also can't be super loose, like just having skin in the bottom, because again, that wouldn't be strong enough to support everything or be able to do the actions of a sphincter that you need to either hold in your pee or hold in your poop or hold in that gas. That's essentially what the pelvic floor is. And that's what we're talking about when we talk about any issues that women have postpartum or during pregnancy.
Gotcha. That's a great description because again, I think like you said, it can get very technological with the words and the terms, but for a lot of us, we know a little bit about it, going in, especially during pregnancy, with our bodies, I think you learn a little bit more, but then post pregnancy is when you really are okay, well, why is my body doing this?
Yes. And I feel so many people are so scared to even look down there. Nobody wants to know what's going on down there after having a baby. They're just too scared.
It's like the Sex and the City episode with Charlotte, and she's like, oh, I've never looked down there.
Exactly.
Yes. So how can it be injured during pregnancy? And is there anything that can be done to prevent it?
Yeah. So pregnancy is a normal part of life. I don't want to ever think that because you're pregnant, you're going to get all these problems. There's definitely lots of ways to prevent any issues from happening. But you can understand that during pregnancy, you're holding this big watermelon type of weight inside your body. Granted, it's not for the duration of that time, but it's slowly getting bigger and bigger and bigger. So your body has to accommodate. That's why you have a little bit of flexibility in your joints and in your pelvis. So they are able to give room for that growing weight. But what some people can suffer with is they just don't have the strength in their pelvic floor to kind of hold on to that weight for a long period of time. Or they're the type that they have the sensation of pressure down below, like around the vaginal area, but they almost squeeze their muscles all the time. It's like they're trying to hold all this weight up 24/7. So then they end up with overly tight muscles.
Okay.
So you might fall along anywhere along that spectrum. It's just because during pregnancy, you're holding on this big weight, this big growing weight that your body needs to adjust to. Some of us adjust really well, and some of us don't adjust as well.
Gotcha. Okay. So now I guess what can be done after delivery? Like after we've, had the baby and we're holding all that weight, like that's when you normally experience, okay, now, maybe it's, you notice you're peeing yourself a little bit, or when you're jumping up and down, working out. So is there anything post-pregnancy that can be done for this?
Yeah, for sure. So if you haven't been proactive during pregnancy, then there's definitely all the things.
Yeah, let's talk about that first. Actually, let's talk about what we can do during pregnancy for this, and how to kind of what we can do, what measures we can take.
Yeah, for sure. So a lot of times people during pregnancy think this is just pregnancy. It's normal. Pain is normal. Discomfort is normal. My back pain is normal. This pressure down below is normal, and they don't do anything about it. When really, if you take the right steps during pregnancy, you can prevent a lot of the issues down the line or right after delivery.
Mm-hmm.
So during pregnancy, you can work on a lot of things like making sure that you're in the proper posture or the right alignment. Because as you know, you have this big belly that's growing out at the front. You start to arch your lower back even more. And that's putting your body at even a more predisposed position for injury. So you're stretching out that abdomen even more.
Right.
That could lead to abdominal
separation. You see women walking around with their hands behind their back, with their belly stretched out. Yep. That's the
look. Exactly. Like that. You can make that a little bit better on you by just having a little bit more mobility in your pelvis. So working on pelvic tilting, working on stretching out that lower back, and just working on engaging the inner core muscles. And we're not talking about doing planks or abs or sit-ups or crunches during pregnancy. We're talking about the deep inner work that almost looks like you're doing nothing at all. Mm-hmm. So things like practicing deep breathing techniques, activating what we call TA or TVA, transversus abdominis. It's a nice deeper core muscle. Some people will call it ab wrapping type of exercises, as if you're trying to kind of pull things in towards your body and hold that weight in. Right. You can do those during pregnancy. You can work on your pelvic floor during pregnancy by doing pelvic floor contractions, sometimes referred to as Kegels. Those are really healthy to do, and working on those while you're doing other things. So if you're active during pregnancy, working on pelvic floor contractions while doing squatting or lifting, making sure that it's engaging during all the things that it should be engaging in. At the same time, also learning how to relax those muscles at the same time. Because a lot of times if you are not new to the gym or working out, then you know as much as you need to strengthen everything, you also need to stretch it and actually let it be flexible.
Right,
so
right.
Same thing during pregnancy.
Yes. Yeah. Making sure that you're staying active during pregnancy is something that I totally am all for. And I think that's the reason why I had I hate to say easy, because it was not an easy pregnancy. I had really bad sciatica in the end and heartburn, but because I was active, I didn't get mornings. I mean, you can accredit it to so many different things, but I just feel like living a healthy lifestyle really did help make pregnancy a bearable one. Let's just say that.
Yeah, that's a good way of putting it. 'Cause it is true. Like being active just means you live a regular, normal life. Pregnancy isn't something that's abnormal. It's a part of a normal female life for the most part. Yeah. We just kind of have to incorporate the fact that it's a changing body and we have to adjust to that.
Exactly. So you're talking about the Kegels. So how often should a woman who's pregnant or not pregnant be doing Kegels? Is it something to do like early on in your pregnancy? Is it something to do post-pregnancy? Like give us kind of like an idea of what that looks like.
Sure. If you're not pregnant, you don't have any children, usually what I say is it's not something you necessarily need to be proactive about. You don't need to be doing your Kegels 10 times a day, every single day, but it's something that you should be aware of if you're not having any issues. So for instance, I tell them to just make sure that you can do the contraction and that it's still there. So you could kind of give it a test as you're sitting on the toilet, going pee, and seeing if you could stop the flow and see what that feels like. See if you're able to recruit the muscles that you're trying to recruit. Mm-hmm. It's more of like a test to make sure things are okay. Then when you're going to more the pregnant population, so when you're actually waiting for baby to come, that's when you need to be more proactive. That's when you should be doing your Kegels 10 times a day, every day, making sure that you're not doing it in a distracted way. So not while driving, not while watching TV, because the unique thing about the pelvic floor is that you can't actually see what you're doing. It's not like I can ask you to do, to curl your biceps or to do kind of that curling action. You can see what's going on. You can see the muscles are doing it. You can see if you actually lift the weight all the way to your shoulder versus and relax it all the way back down. Can't see a pelvic floor contraction. You have to go solely by what we call like a biofeedback, by what you're feeling. So that's why I highly recommend that everyone do it in a non-distracted setting, and just work on your Kegels, work on recruiting those muscles. What are you feeling? Are you able to feel like not only are you squeezing things together between your sit bones, but you're also pulling in towards your body, because that's a full contraction. Most people will feel kind of like closing, but not necessarily a pulling up. And that's not a complete contraction. And so during pregnancy, you need to be able to do all those things daily, as well as making sure that you're practicing deep breathing to relax the pelvic floor muscles, because you want to have that control during labor to actually relax those muscles at the same time. So it's kind of like you're preparing for labor, and by doing all these things, you're prepping for actual delivery of baby and for how things are going to feel after.
Right. That makes so much sense. Now, what about for the woman for post-pregnancy? How often does she want to be doing this?
So it depends. This is where, let's talk about the woman who's not really feeling anything. She's not leaking. She's living an active life. She's doing lots of things. She's sneezing. She's laughing. She's running. She's jumping. And she has no symptoms. I would say keep on a little bit of that proactive 10 times a day. Ensure that what it feels like now is what it felt like at the beginning of pregnancy.
You said 10 times a day, but like how long are the holds for?
At that point, I would probably only hold about 2 to 5 seconds. Okay. And there are different types of exercises, like just like, again, any type of workout routine, there's kind of these sustained holds. You're either working for, with the pelvic floor, you're either working for just engaging the muscles and getting a powerful engagement. The other way is you're working for speed, because it needs to work well for when you're sneezing or laughing. It needs to be quick to come on.
Oh, wow. I didn't think about that. Okay.
Yeah.
Yeah.
The third part is endurance. Yeah. It's just things you don't think about, right?
Yeah.
And the third part of Kegels is endurance. So actually being able to hold on to, if you're running and you haven't fully emptied your bladder and now you got to wait till you get home and get to the bathroom, it also needs to be able to hold on for a certain amount of time. So for the average woman who's not really feeling any symptoms, things are feeling good, nothing feels off, no pain, core is nice and strong, is living an active life, I would say more keep along the lines of proactively just making sure you can engage those muscles, making sure you can fully relax those muscles on a daily basis until you reach about one year postpartum.
Okay.
As I cough. Cold symptoms. For those women who are actually feeling symptoms, so if you're having leaking while you're running, while you're jumping, when you sneeze, when you cough, then it goes back to trying to figure out what is the problem. Is it when you squeeze, you can't really feel like you're getting a good hold, things aren't actually closing together? Then you need to be more proactive at working on just doing the proper movement without using the bigger muscles. So like without using your abs, without using your glutes, without trying to squeeze your legs together, just the pelvic floor, being able to contract like do a Kegel and be able to just hold it as best as you can. Okay. Then for those who have the more reflex problems, so like when you sneeze, cough, or laugh, it's an automatic thing for your body to prepare for that increased abdominal pressure. So it's an automatic reflex for it to tighten your pelvic floor as you cough or sneeze. Sometimes people will kind of lose that reflex. So all they work on is just reaffirming that reflex. So for instance, I will ask these women to practice cough so that they squeeze, cough, and they don't have to, they don't actually have to cough.
Right.
But you're just reconnecting that brain to muscle reflex. That's another exercise.
Next time when it does happen, it'll be more automatic than just something that you have to think about.
Exactly. Because it goes along the lines of like that, if you don't use it, you lose it.
Yeah.
Your brain doesn't. Yeah, exactly. Like you need to reconnect that brain to the muscle and how it's actually supposed to work. And the more times you do it, the more times your brain is going, right, this is exactly how it's supposed to be, and starts to make that automatic reflex again.
Gotcha. So is it normal for you? I mean, this is like I said, this is such a girl topic. Like men have no idea what this is about, you know? So is it normal to pee your pants when you're coughing or running or jumping up and down or sneezing? Like, is that something that's normal?
It's absolutely common, but it is 100% not normal.
Okay.
And the reason why I make that, I distinguish that is because a lot of women will say they have lots of friends who do that therefore it just must be part of aging, a part of having children, when in fact, what we're doing is just going along with an injury. So it's just like if you were to take an extreme example, let's take a soccer player who blows out their knee playing soccer. Right. And they say, well, that's just part of the game. That's just part of soccer. I'm never going to fix my knee again. It's the same idea that by assuming it's just common, we don't deal with it with the issue when it actually is a fixable problem.
Right. That makes sense because it's like if it were something else, like you said, a broken arm, foot, leg, whatever, we find a way to fix the problem. Same thing here. If there's something that wasn't that way before, clearly something's changed. So there's a way to work on that.
Yes. And I think a lot of times we as moms just kind of put things off. Like I know I'm totally victim to it too. You probably are too, where you're like, oh, look at that later because I have something else to do. We tend to put ourselves as a low priority.
Yes.
And I think that's a lot of times when I'm speaking with them going, but you can fix it now much easier and quicker than years from now when it's actually going to take you longer and that much more time away from your kids or the things that you actually want to do.
Right. Exactly. Now, what about, I was a mom where I prepared everything. I did my hypnobirthing, which also kind of goes along with what you were saying, the breathing techniques and getting your body ready, your core, everything for the delivery of the baby. But then the day of, due date, or not due date, but, his birthday, I ended up having a C-section. So surprise, now we're dealing with that. So for all of the moms out there that had a C-section, is this something that they're affected by as well? Because I know for me, I haven't had that, when I work out, I don't pee my pants, I don't, jump up and down, but I'm only on my first baby. So is this something that could happen with my second baby? And also what can I do to prevent that?
Yeah. So statistically speaking, you run the risk of having more issues with more children, right? Because our bodies are stretching and coming back, stretching and going back. So more children you have, it's less likely that things will just be absolutely perfect after having each baby. And to speak to that, it is something that you still can be proactive about. So for you, you're still following in that category of being proactive, of just being able to understand what your body is capable and having a good understanding of what that feels like to use those muscles as well as to relax them. Because that's kind of your baseline for when the second baby or third or fourth baby would come along to actually feel like, let's take you as an example or anybody else. Use that as kind of a baseline. So then after baby, you go, oh, things feel different. Like I'm not really able to get that full contraction. Like I don't feel like I'm squeezing as much, or I feel like I'm tight all the time. So it kind of gives you that nice baseline. So then after baby, you can kind of work on how do I find that good feeling again of what it felt like when it was working well.
Gotcha.
And for C-section moms, a lot of times I do encounter these women who say, well, the baby didn't come out that way, so therefore I'm protected. And you are protected to an extent. You haven't had some of the issues of other women who would have had tearing or episiotomies or the use of forceps or vacuums or any other tools that would have put you or predisposed you to some more injury. But you still carry the same weight as somebody who had a vaginal birth for 9 months. Right. So you still run the risk. Exactly. The baby still sat on there. So the hammock still took a little bit of a hit, but it just might not be the exact same damage that would have come from someone who had a vaginal birth.
Gotcha. Okay. That makes sense. So, whether you have vaginal or C-section, it can affect all of us. So none of us are cleared free. We all
none of us are clear free.
Yeah, we can all experience this. And I like how you're saying that there's that baseline of, okay, this is where I was. And if it's different, then don't let that be. Like, there's things that you can do to work on that.
Exactly. And I should say, like, C-section moms also come with their own, I don't want to say issues, but it's just their other fun things to deal with, like the scar tissue that comes up with having a surgery. Because some people will report feeling like a tightness or some things that it just doesn't feel right when they do certain exercises. And that could just have to do with the scar tissue deeper down. And again, there's still things that you can do to help that along. Okay. Never just go for, it bothers me, therefore I'm just going to leave it.
Right. So are there certain exercises or things that you should avoid to prevent hurting your pelvic floor?
I would say if we're talking about the postpartum period, you want to avoid somewhere along like up until about 6 months to even a year, depending where you are on that spectrum of having any issues. You want to avoid really these high impact activities like jumping, like jump squats, like jump lunges, these things that kind of put you in a vulnerable position where you're opening up your pelvis and it's high impact. Because now you're thinking about all this force that's being pushed down on that hammock that is still recovering. Because it's taken the brunt of the load, it's carried a big weight for a long period of time, and now what you're doing is jumping and overloading it. Gotcha. So I always say to women who are going back to some sort of fitness activity, if we look at you way back, however many years before you actually started being active, you started slow to prevent injury. We didn't throw you into the weight wax and put 200 pounds for you to squat. The same idea with postpartum period. Your body is different. It's still recuperating. It's still, the laxity is still there in your ligaments and your joints. You need to be protective of those and rebuild that foundational strength so you can build up the bigger stuff.
Yeah. No, that totally makes sense.
Yeah. And it doesn't mean like Kegels forever for the 6 months to 1 year. It just means being able to use those muscles at the same time as you do other things and not overstressing them.
Gotcha. Okay. So now for the Kegels, I know you were saying you want to be active, like when you're doing them. Now, is there, say after the first year, and you've done your Kegels and you're still experiencing those symptoms, at that point, is there still something that you can do to work on that?
Oh yes, 100%. Even the years after having babies, you're not a lost cause. It's
okay.
just,
well, that's good to know.
Because most people think they're like, it's been too many years, I'm just done.
Right. Like at what point is it like, so at any point you can decide, okay, I'm going to work on this.
Exactly.
Okay.
You don't know how well you can recuperate until you go in and they say like, listen, there is no use of your muscles. There is something we need more help. Mm-hmm. So you don't know until you get to that point. But the years down the road, you can prevent yourself from actually getting to that point. And it is back to like, if you've been working on your Kegels, you've been working on being active and it's still not working, then it means that you probably are missing something pretty basic somewhere along the lines. Whether it's your technique of how you're breathing, whether it's your technique of how you're moving through a movement, whether it's your technique of actually engaging the right pelvic floor muscles while doing something, it's somewhere along the line. And that's when I usually say, like, if you're struggling, get some help. Because it's just like anything else where we ask somebody for help because we can't do it on our own.
Mm-hmm. Right. So there's certain techniques that you would teach that you'd say, okay, this is just like a regular exercise routine, like a exercise plan,
Exactly.
Is that kind of what it looks like?
Exactly. And sometimes it's just like the right wording to even use it. Like what might work for you, if I were to tell you contract your pelvic floor in this way, won't work for necessarily your neighbor. But if I give her a little bit of a different cueing or how I verbalize it to her, it will work for her. It's just so different, these like subtle things.
Yeah. Well, that's good to know. I mean, because, especially as moms, like you said, we put everything off. Like we kind of get the back seat until everyone else's needs are met. And then years go by and we're like, oh yeah, we're still dealing with XYZ, So this is something that can be very easily overlooked because again, you might think it's normal and that there's nothing to do about it. But the good news is Vanessa's telling us that there is.
Exactly. And I think everyone always thinks they're a lost cause, but you're not. You don't know until actually you go in to see someone and they say like, you know what? Yeah, you might need some extra help.
Right. So now when you work with these women, how long are they like, are they on a plan? Are they on a set like 3 weeks, 6 weeks, 12 weeks? Like, what does that look like?
I would say it depends on how far along they are and how good they are at engaging those muscles. For those women who it's been years, they don't even know what a Kegel feels like, they don't know what they're doing is proper, that takes longer. That's just a little bit of a longer road, because we're not just teaching you how to strengthen them, we're teaching you what that muscle even feels like. And that's a lot harder than just teaching someone to really use those muscles just a little bit stronger.
Right.
So on the easy end, for those people who are just having symptoms, who are just having a little bit of leaking, but they're very good at feeling a good Kegel contraction. They're very good at feeling when their pelvic floor relaxes. That is a really quick process, because all I need is a bit of guidance on how to make that a little bit stronger and how to use that more functionally. And functionally meaning day-to-day life, exercises, whatever they love to do.
Exactly.
So it varies is the bad answer, I guess. It just depends on where they are along their journey.
Exactly. Like if they've had 1 kid, 2 kids, how long it's been since the pregnancy. So all of that goes into a factor.
Yes.
Okay. Now also abdominal separation also kind of comes into this, because we're talking about core. So can you tell us a little bit about how that happens, when it happens, and how it affects us as well?
Sure. It's pretty common. The good thing is, I shouldn't say really common, it's common that it's out there. People, and I really love that it's being more talked about lately. People talk about having this gap in their abdomen. They talk about diastasis recti, which is the really fancy big word for it. And what it essentially is if you think about somebody who has a 6-pack, there's 3 on one side, there's 3 on the other side. The abdominal separation is somewhere in the middle between those two, the right and left side. Mm-hmm. Anywhere between underneath your ribs to just above your pelvic bone. Most people are just looking around their belly button or somewhere particular, but it could be anywhere along that stretch.
Yeah.
The separation of your abs happens normally during pregnancy because it has to open up as you're growing the baby.
Exactly.
But the abnormal part is when after the postpartum period, after the first few weeks postpartum, that gap stays. And especially if you have any other symptoms like back pain or leaking, or you feel like things are kind of popping through that gap, that's when it's a little bit more of an issue where you need to rehab on actually closing that gap.
Mm-hmm. So that's possible as well?
Yes. I would say for the good majority of the population, closing the gap is pretty, I don't want to say easy. It's a simple process, but it's not necessarily easy.
Okay.
There are a small population where it's a pretty severe gap,
right.
And it's really, really deep that they need a lot more professional help. And sometimes there are some that need more surgical help to actually relieve all their symptoms.
Okay. So now what comes along with that? Because I know obviously if this is an active mom, working on her core, that has to, that all ties in together. But what are some of the symptoms that you would experience other than seeing that separation?
Yeah, so it's a tough one because most of the time people notice it as they become more active, that they are trying to work on their core, they're trying to do crunches or planks, and they start to feel this kind of, they start to see this like protrusion in the middle of their belly or coning or doming, like there's all these different types of words for it.
Yes.
Most of the time I'd feel like their symptoms are they either leaking or it's this kind of funny sensation of just something pushing through your belly that shouldn't be, which is so hard to describe to people. But if you have it, you know what I mean. When you're like, oh. And I should say, like, as a mom myself, after my first pregnancy and doing more intensive workouts, this would have been about 10 to 11 months postpartum that I experienced a little bit of what they call a functional abdominal separation. I actually started to experience coning and doming and that protrusion feeling.
Right.
So it doesn't, just because it's the early stages doesn't protect you again. It just means that you still have to work on the weaknesses that may not show up until you start to work out harder.
Yeah. Okay. So, I mean, all of this ties in together though. All of the abdominal separation to, if we're leaking again, when we're running, jumping, sneezing, all of that, it's all tied in together.
Yes. And that's what we call the core. And my biggest analogy that if anybody's been following me, you'll see that I talk about this a lot, It's like a pop, I call it the pop can analogy. So if you think about your core as a pop can, where the bottom of the can is your pelvic floor, the front of the can is like your inner abdominals, the back of the can being more the deeper back muscles that work as stabilizers, and the top of the can is your diaphragm. So all those working together is what gives you a nice, strong, stable core to allow you to move well and not run into any injuries. So any of the problems that you have could come from any of those parts.
Okay, gotcha. So yes, I mean, I think it's super important to be aware. I mean, obviously you'll know post-pregnancy if you're having these symptoms, but the good news is that you can work on it. And there's I guess, little tactics and things that you can do to help prevent that. So I would love for you to share with the moms, about your courses, where they can find you so they can get some more information on what you offer and how you can help them.
Yeah, for sure. You can find me on Instagram as Core Strength Mama, which is exactly what I do. I also run a Facebook group called The Simple, Happy, Healthy Mom Life. And that's where I talk a lot about, and I share videos that are a little bit more personal, because a lot of moms don't really want to talk about the deep underbelly of what it means to look at your vagina out in the open on Facebook. So it's super private. Right. It's only for moms. As for the courses that I'm running right now, by the time this airs, I will be at the end of opening my first just mom focused course. And that means it is a group program that is essentially dealing with and talking about what we're talking about today, where it has to do with reteaching women how to actually use their core properly, how to put that into a workout program. Because I know that a lot of moms don't want to put that on pause. We don't want to work on just Kegels when we're also working on losing the baby weight. So it puts it hand in hand. They're working on their pelvic floor, their core, while they're working out and while they're learning how to really love their bodies again.
It's typical mom life, multitasking at its finest.
It's tackling all of the things and making sure that it's okay when you don't do everything, because that's your life and that's okay.
Yeah, for sure. And again, it's nice to know that, like, no matter where you are in that journey, maybe you're a new mom and you like are hearing about this for the first time, because you haven't had your baby yet. Or maybe it's the mom that has, multiple kids and she's like, I put this off for so long, like I'm going to handle it now, because it's like you said, it's like, even though we can't see it, it's still there. And it's important to, to make that a priority, especially ourselves, our health. I mean, I'm such an advocate of, again, healthy pregnancies, healthy living. So I think that we as the moms kind of run everything else. We make sure everyone else is good, but everything for us kind of gets put on the back burner. So it's good to be able to focus on our own health to make sure everything else gets done.
Exactly. Because we don't want to burn ourselves out, because we love our family so much. We don't want to put our burdens of not taking care of ourselves on them. If we want to be the best moms that we want to be, we also have to take care of ourselves.
Definitely. So what would you say, like, your top 3 tips for a mom that's listening to this podcast? What would be your top 3 tips to give her as a takeaway on how she can start to repair this?
I have some really good ones, and they're going to sound really funny. And I know it's something that you can all start doing today.
Awesome.
First one is all about pooping. It's exactly how you sit on the toilet. It was a few years ago that the squatty potty became super popular. The reason being is that it actually helps correct that curvature in your rectum as stool passes down.
Okay.
So that way it's more of like a straight chute. The position is essentially, as you're sitting on the toilet, your knees should be above the level of your hips. Don't try to brace yourself in that position. Don't try to hover your feet off the ground, because then you're using your pelvic floor and you're closing it off. Okay. But if you can find a stool, any stool, prop it under your feet so that you're more in a squatting position while you poop. That's going to make a big difference on your pelvic floor.
Wow. Okay.
Yeah. The second thing has to do with, we're also used to sitting on the toilet and straining when we have to poop. We're so used to kind of taking a deep breath and just bearing down. And what we're doing is we're bearing down all that pressure on our pelvic floor. So change that. So you're actually practicing deep breathing or belly breathing, because that actually acts like a pump on the rectum. So it kind of opens and closes. So it pushes the stool down without forcing it down.
Oh, wow.
Yeah.
That's kind of like
simple thing.
also for labor too, you know, it's that breathing technique of using your breath and we said like follow the wave was what
Yeah,
our
right.
teacher would tell us. Yeah.
It's pooping is birthing a child on a much smaller scale.
Yes.
And the final thing is, and this has to go with moms who are kind of scared of leaking or are scared that this will become part of their problem, and they're scared of drinking water. When limiting your water intake, it could just actually make it worse. You want to have as much water as you physically can that's safe for your body, obviously, because when you're not intaking water, it concentrates your urine, so it becomes more acidic, and that acidity actually irritates your bladder, and it makes you feel like you have to go more. So both not having enough water, drinking too much caffeine, and I know as moms, some of them thrive on caffeine.
Right. Yep.
Caffeine irritates that bladder too. So you want to make sure that you're limiting that so that you're not causing yourself problems. 1 cup a day is usually what physiotherapists will recommend as kind of your limit when you're having leakage or when you're having that sense of having to go to the bathroom all the time.
Gotcha.
Those are like the 3 things that I tell every single woman to start right away, because it's such a healthy thing to get into, to have a healthy pelvic floor.
Awesome. That's great. It's things that they can implement right away. So,
easy.
Yeah, that's awesome. Well, Vanessa, thank you so much for jumping on with us today and giving us all this great information. Just tell us one more time where all the mamas can find you.
Yeah, they can find me easily as Core Strength Mama on Instagram. Feel free to send me a message. Feel free to ask me weird questions, because I have heard it all when it comes to pelvic floor problems and what symptoms you have. There is nothing that weirds me out. There is no judgment.
Yes. I think, after we have babies, it's like after you've been on a table and there's doctors running around a room and you've gone through all of this and that, you're like, whatever, like who even cares anymore?
I know. It's like,
we've all been through it. We all know, we've all been there, as moms. So it's like, we just get it.
Yeah, exactly.
Yeah, cool. So anywhere else you have a website?
Yeah, you can find me at theinspiredactionmethod.com. You'll see what I'm all about and what services I'm offering to help moms just like yourself to stop peeing their pants and lose the baby weight.
Awesome. Well, Vanessa, thank you so much for being here today. And again, mamas, reach out to Vanessa and ask her all those scary questions that you probably don't want to ask anyone else. Again, she said she's heard it all. So
go for it. Try to make me blush.
Awesome, Vanessa. Thank you so much for being here today.
Thank you so much for having me on.
All right. Bye-bye.